fear. You know, it's a primal instinct, right? It's that internal alarm that's kept us alive for millennia. But what happens when that alarm gets, well, stuck in the on position? When it starts blaring not just at real dangers, but at totally everyday things? Well, for millions of people, that's exactly what happens. A simple fear spirals into something that can truly take over your life. So let's really dig into what a phobia is, and maybe more importantly, what we can actually do about it.
Just think about that for a second. We all have things that make us a little nervous or uneasy. But there's a huge difference between having a healthy respect for heights and, say, being completely unable to go above the third floor of a building. So where is that line? When does a fear stop being a protector and start being a prison? That's the big question we're going to tackle.
And here it is, the clinical answer. A phobia isn't just being really scared of something. I mean, look at those words. Persistent, excessive, irrational. This is a fear that just doesn't let go, that is so out of proportion to the actual threat, and the logic can't even touch it. It's a fear so powerful that you literally start rearranging your entire life just to avoid the trigger, causing real, genuine anguish along the way.
Okay, so to really get a handle on this, we've got to pop the hood and see what's going on inside. We're about to break down what a phobia actually is, from how shockingly common they are, to what is physically happening inside your brain when that fear just takes hold.
Now, the sheer scale of this is it's striking. If you've ever felt totally alone with an intense fear, I really want you to take this number in, because you are so far from alone. Studies show that up to 1 in 10 of us will deal with a phobia at some point. That means in any random room of 30 people, probably 3 of them know this feeling firsthand. So yeah, this isn't some rare, bizarre condition. It's a really significant part of the human experience.
So what is actually going on up there in the brain? Honestly, the best way to think about it is like a faulty smoke detector. Deep in your brain, you've got this little almond-shaped area called the amygdala, and it's basically your threat detection system. Now, for most people, it works just fine. But in someone with a phobia, that system is wildly oversensitive. It's like the smoke detector doesn't just go off for real fire, it screams a full-blown 4-alarm emergency every single time you burn a piece of toast.
And here's how that one false alarm just cascades through your entire system. See, a phobia isn't just one thing. It's a vicious, self-feeding cycle. Cognitively, your thoughts just spiral. This dog is going to attack me. Physiologically, your heart starts pounding, your muscles tense up, your whole body is just screaming danger. Behaviorally, you cross the street, you leave the park, you do anything to get away. And emotionally, you're just flooded with dread. And the worst part? Each of these pieces fuels all the others, making that cycle stronger and stronger every single time.
Now, these intense fears are usually grouped into 3 main categories. First up, you've got specific phobias. These are probably what you think of first, that intense fear of spiders or flying or needles or heights. Then there's social phobia, which you might also know as social anxiety disorder. This is a debilitating fear of being judged, embarrassed, or humiliated in social settings. And finally, agoraphobia, which is often misunderstood as just a fear of open spaces. It's actually a fear of being trapped in a situation where escape might be difficult, or help wouldn't be available if you started to panic.
All right, so how do we break this cycle? How do we start to manage this? Let's start with the modern medical approach. Fundamentally, it sees a phobia as a learned response that's, well, gone haywire. And so it focuses on really concrete, evidence-based strategies to actively retrain the brain's fear circuits.
When it comes to treatment, the undisputed heavyweight champion is cognitive behavioral therapy, or CBT. Now, this is not just aimless talk therapy. It's a super practical, structured approach. It gives you the tools to identify, challenge, and then change the 2 things that keep a phobia alive and kicking: those catastrophic thoughts and those avoidance behaviors.
Now, the engine that really drives CBT for phobias is something called exposure therapy. It is this very careful, very gradual process of facing your fears in a safe, controlled way. So, for example, if you have a phobia of spiders, they don't just throw you in a room full of them. No way. You might start by just looking at a cartoon drawing of a spider, then a realistic photo, then maybe watch a video of one. Each step is small, it's manageable, and it proves to your brain again and again that that smoke alarm was wrong. The catastrophe you fear doesn't happen, and slowly but surely, that alarm system starts to recalibrate.
But retraining the brain's specific programming is only one way to tackle this. So now let's shift gears and explore a really fascinating and complementary perspective.
The yogic view isn't so much about extinguishing one specific fear, but more about regulating the entire mind-body system to make it a less fertile ground for fear to grow in the first place.
This quote right here, it just nails the whole idea. The goal isn't to never feel fear again. I mean, that's impossible, right? Instead, it's all about changing your relationship with fear. It's about developing this kind of inner calm and stability that allows you to notice that feeling of panic rising, to just observe it without immediately reacting, and to consciously choose a different response than just running for the hills. So, how does this actually work in practice? Well, yoga offers this amazing toolkit for the body and the mind. You have pranayama, or controlled breathing, which is such a powerful tool because it directly hacks your nervous system, telling your body to shift out of that panicked fight or flight mode. Then you have asanas, the physical postures, which help you feel more grounded and stable and present in your body. And of course, meditation, which trains your attention, helping you learn to see anxious thoughts as just, well, thoughts, not absolute truths you have to obey.
So here we have these two powerful but very different approaches. Think of it like this. Modern medicine with CBT, it's like a highly trained sniper. It takes this precise aim at the specific, learned fear, and it's designed to eliminate it effectively. Yoga, on the other hand, is like building a fortress. It's a slower, more holistic process of strengthening your entire foundation so that you're just better equipped to withstand any attack from any direction.
And this brings us to a really powerful idea. What if you didn't have to choose between the sniper and the fortress? What if the most effective path forward is to combine their strengths, to finally treat our mind and body not as two separate problems, but as one single, interconnected system?
This is where the real magic happens. So think about it. CBT and exposure therapy are like a brilliant programmer going in to debug a specific piece of faulty code, that one program that keeps crashing your system. Yoga, in contrast, is like upgrading your entire operating system from the ground up, making it more stable, more resilient, and way less likely to crash in the future. When you do both, you're not just fixing the bug, you're upgrading the whole system. That's how you get a powerful and truly lasting solution.
So I'll leave you with this thought. What if we could reframe our entire approach? What if we stopped trying to fight our fears head-on and instead started working with our own biology? When we start treating our mind and our body as a team, working together to build a life of resilience, of well-being, and of freedom, well, the possibilities are absolutely endless.